My name is Sion Roy. I'm a cardiologist at Harbor UCLA, Assistant Program Director for our Cardiology Fellowship. And then we're here at the Lundquist Institute in Torrance. So I think I joined the California Medical Association almost 15 years ago when I first moved here to LA to do my cardiology fellowship at Harbor UCLA. And I remember we moved to Santa Monica very early and having a conversation with my wife, who's a radiologist at UCLA. And she said, advocacy is something that's really important to you. Don't wait till you're finished with training to get involved with advocacy. And it's been a really rewarding journey, experiencing leadership and camaraderie with so many physicians. It's in so many different roles over the last 15 years.
Dr. Roy is truly inspirational, and watching him balance his academic career and also the advocacy that he does for healthcare has been truly inspiring.
I really liked science, and I really wanted to do something rewarding that helped people during my career and helped my community. And I thought being a physician was a good combination of those two things. My journey took off from there.
Dr. Roy is an expert in cardiac imaging, specifically cardiac CT. He not only spent time training under one of the world experts, and then he continued his training here with us.
Cardiology is a great profession because it involves acute care, where you help patients and families at their biggest crises moments. And I find it really rewarding to go through those moments with patients and their families. I like to think of myself as a preventative cardiologist, and so that we can help detect and attack cardiovascular disease before it causes heart attacks and cardiac arrests and those types of terrible outcomes.
Dr. Roy's had a profound impact in my life, the way I see cardiology, both from a patient care standpoint. He's a great advocate for his patients, but also to look more globally in terms of patient population management. He teaches us about advocacy for patients, both on a granular level, individual patients, as well as for the population at large.
It's not just about being a physician, in the hospital. It's about being a physician in the community and being a leader and making sure that evidence-based policies are something that communities find important. I love the community that we care for here at Harbor UCLA. We care for South LA, and it's a community that needs advocacy in many, many ways, but particularly as we see Medi-Cal cuts that are coming from the federal level and the state level. And my mission in life is to advocate for the healthcare of this community. We lost our home in the Palisades fire in Malibu. On January 7th, I woke up and I went to work. Mid-morning, got the call that from our neighbor that something was happening. And my wife and son, they evacuated from our house. We were hoping for the best, but we expected the worst. And that night, the fire swept through our neighborhood, swept through our community, swept through the place that we love. And in the morning, we woke up, and we didn't know whether our house was there or not. And I went to work in the cardiac ICU because I had patients to take care of. And I felt like it was, my duty to do that morning. It was my obligation as a physician. And later that morning, we found out that our house had burnt down. And and that's when it started. That's when sort of our recovery process started.
As much as his family and he was under stress and dealing with the heartbreak of really losing everything, he continued to think about his community and how he advocates for his community.
My only option was to get a heart transplant. Dr. Roy talked to me. It was the only way that was going to save me. Every step, he was there. He was there with me. Dr. Roy saved my life. My whole family is very grateful.
The biggest lesson that I've learned as a physician to date is to treat every patient as your family member. That's how I try to think through complicated decisions, because in my field, in cardiology, there's complicated decisions to make sometimes. And so, and I try to put myself in their shoes and think about what I would do if it were me or my family member. And that's how I try to frame it. And that's how I try to teach our trainees to frame things.